So there's a 40-year-old gentleman, weightlifter, who at work injured his labrum. This is the socket, the glenoid. This is the humerus, the ball. This is the long head of the biceps tendon. And this is labrum. See how it's torn off like this? This is abnormal, especially that. That is not good. So we're going to repair. We're not going to repair this. We're going to trim this out. And then we're going to reconstruct this biceps tendon, which is connected to the labrum.
You can see the video on your website, or?
Yeah.
You have an Instagram too, right?
Yeah, man. We're going to do it. We may as well do it. Make it clear everything. That's, yeah, that's because of the size. Oh! Sometimes better to be lucky than good.
It literally jumped over.
That's so funny, dude. That is so. Maybe.
I was
Maybe you gotta figure out how to try it. Yeah.
Brought us some luck this morning.
That was your luck. Good job. Good job, ladies. A lot of luck. Thanks. So, do you want to try it? Yeah, let's see. So we were able to put. Tim was able to do his flawless technique and get the tape around the first time, and now he's going to be passing suture through the biceps tendon. Hard to see though. There we go.
Yeah, it's going to be the full possible time.
That's okay. Take your time. Take your time. So this is somewhat of an unedited video, so you're not just seeing when it's easy, but you see when we struggle, which we do. Not everybody's biceps reads the textbook, and medicine is definitely much more of an art, as is surgery, than a science. What do you think, bud? I like that.
Yeah, I think that looks good.
Yeah. Good.
Yeah, you should go on. I think that'll be all right.
Okay. So we were able to get the tape around the biceps tendon, and now with a different arthroscope, a 70-degree scope, we have a good angle about where we're going to put the anchor down. That's where I want to live. So we put a hole in the bone, and then we're going to, go ahead. We're going to now place this anchor right here into the bone with the tape attached to it. And then, see that anchor going into the bone? That's going to secure the tape, which is around the biceps, down to the bone. And that little bit of bleeding, there's stem cells that come out of there, that's going to heal that biceps tendon. Now it actually. Yep. We'll cut that bad boy. We'll be in good shape. So now we're back to the 30-degree scope, and this tape has now secured with the anchor of the biceps. Instead of being attached over here, the biceps tendon, this long tube, it's attached over there. So we don't need it attached in two different places. And so we do what some consider sacrilegious, but it's okay. We disconnect the biceps tendon from its natural origin. And we do essentially a reconstruction. So now it's attached over here, as opposed to being attached over there. Shaver. So this is his bone spur. We're taking this ligament off so that I can see that bone, which is here, exposed. And polish and smoothen that out so it doesn't dig into this rotator cuff down here. Let me get that burr a second. Just coagulating the bleeders. Okay, I'll take that burr. This is a motorized burr. What it does is, it takes off a little of this bone. Cooker. And there's a bleeder in there somewhere. I'm going to coagulate it using this electrocauter device. Burr again. Thank you. And then I take a quick look. First I see it this way, and then I take a look from another angle and look at it from the other side. Let's get a little view. It's a little bit of bleeding that we're going to holes we're going to provide in the spaces. Can I get a part? Probably okay. Let's get any bleeders out of there. And let's burp. Don't need much, but this is the burp. This is looking at that bone from the other angle. Because the camera's in another spot. I'll take a shaver. There's a lot of inflammation here in what's called bursitis. I'm going to take that out. That'll make it feel a lot better. Which is one of the reasons we do this. So in surgery, I feel that it's important not only to treat the problem, but potentially do some prevention as well. This red stuff right here has got to go. Looking good.